Okay, so go ahead and give us a shot. So start with that at your chest. Good.
It's on. It's Thursday morning, taco day on. Are you excited for the taco fiesta?
Yeah, if I make it.
There might be some baseball players that show up. The rumor in the locker room that I'm having a taco party with the office, and I have a feeling that he's trying to get people to show up. We'll see. Good morning, everybody. Welcome back to Kalkstein Chiropractic. So I'm excited to show you this. This is something new that you might not have been have seen on our YouTube channel, or that you might not have seen really in general. So when we do the dry needling, it's really important that we focus on those areas of tension. And when I find multiple trigger points, like I did with Daniel's knee this morning, what I like to do is utilize Stim on the needles themselves. So you might have seen this, maybe say if you've gone to an acupuncturist, use this type of model of Stim treatment onto the needles. I think it's very effective for putting more energy into that treatment, and it helps with muscle release and helps with pain. And I think it helps deeper than superficial Stim can do on the body. So with this type of Stim, Tegan is going to turn it up slowly. She's going to ask him to let him know. She's going to ask him to let her know when he starts to feel it and when it's strong but comfortable, similar to how we turn up our Stim in the other room. So again, this is very effective for decreasing muscle tension and helping with pain in the area. So I'm going to stop talking so loudly so they can communicate, and you can check out the needles and see them humming and see them contracting back and forth from the Stim. Okay.
Good there? Okay.
Thank you.
If it ends up being too strong, sometimes there's a little bit of a delayed reaction, so it feels okay at first, and then it kind of amps up a little bit.
Okay.
Let me know, and I can turn it down.
Appreciate it. Thank you.
No problem. Let me see if he has a timer set for you. There we go.
Slow and steady.
Can you switch into 13? I just did.
Alright, Randy, next for the squat, make sure you have a lateral squat. So you're starting out nice and wide stance.
That's a lot better.
That's a lot better from when we started.
That's good. Okay. So about 2 fists worth away from the thigh is when it starts to slow up, and then you get pain about a fist width away from your heel to your glute. So at full range of motion in the knee would be bringing your heel to your glute, but everybody's knees are different, and anatomy is a variable thing. Even though in the textbook it says one way, it shows up a lot of different ways. So this knee's had a little bit of change to it, and compared to the other knee, we're still about 10 degrees off a full flexion for you, but I think that slowly but surely we'll start to get that more and more like we've been doing. So I'm just going to do a little tool-assisted soft tissue work on you, just to clear up some of that tension from the IT band and some of this fascia on the outside of your knee.
Okay.
I'm using a little bit of cream to help me do it. Okay, this cream is really good superficially for some muscle pain, as well as for itchy skin and swelling. So this cream's got, don't you see it? This is a local acupuncturist who sources this stuff out from Colorado. It's got CBD. So CBD is just a plant-based anti-inflammatory, just like turmeric. Berberine. But I think it's very effective for muscle ache. Okay. Good morning, everybody. Welcome back. We just finished up a session of dry needling on the quads for Daniel here, as well as we did some Stim with the dry needling. He's been shown exercises for running, a good warm-up routine for his running protocol at home. We changed up his pace a little bit, changed up his gait. He's having fun running. He's doing taekwondo. No, jiu-jitsu. Sorry, you just told me that, jiu-jitsu. Yeah, he's crushing it. He's having a lot of fun doing all those things. So we're really happy for him, and we're continuing to adapt and change his treatment as he's getting better. So I'm focusing a little bit more on this last bit that's not letting go in terms of some of the tension he gets on his lateral quad and on the outside of his knee. And so this is a nice, easy way. Let me know if the tool is bothering your knees at all, okay?
I'm good.
This is a really nice way to get local to a tissue to break up adhesion and get better mobility in the area. But I think it also really helps with discomfort and pain when people have an area that's really sensitive or sensitized in some way. Again, this is nice too because I put my hand on him a couple times in this area. I'm working it in different patterns. This tool, you can actually get a good feedback from the tissue to feel the I think you get to feel a little bit more of the consistency of the tissue, so I can find scar tissue a little easier when I spend a little bit more time around a joint like this. And he's got some on this kneecap here. You feel like it's a little bit more intense underneath the blade around the edge of this. When I get into fascia that's tense or has maybe a little bit more adhesions within the tissue, it'll be a little bit more uncomfortable for you, okay?
Okay. I'm still doing good though.
Okay. You're tough. Very tough. How many boys do you have, Daniel?
3 boys.
3.
All grown.
3 young men.
Yep.
I'm trying to have 6 kids one day.
All right.
6. That's my
Ambitious.
goal. It's my goal. I don't know if that's ever gonna happen, but there's a lot of kids out there. We talked about fostering kids,
Yeah.
which I think would be nice, and as well as adoption. Adoption's a little bit more complicated.
My son Matthew's visiting now, so I have my granddaughter at the house.
You do?
Yeah.
That's awesome.
Yeah.
How fun is that, man?
That's fantastic.
We had Charlotte in yesterday. She's getting potty trained, and she's like a year and 2 months or 3 months. She's a little all-star. I'm like, oh God, Allison, good luck. You got a fast growing one. She's gonna be smarter than you at like age 6. Good luck, Dr. Blake. you can look back at this video in the future. You got an independent one on you. Good. So I'm doing ART on the quad group now. So I follow up some of that soft tissue work that I'm doing, and then I come over that same area that I know there's tension or there's trigger points, and where he's having pain. So I really have 3 good markers to treat this area, right? And I've got good objective markers from his experience with the pain and how he responds to care, as well as just taking him into deflection and seeing how it feels. So my whole hand is grabbing on the back side. I'm putting pressure, and my shoulder is actually leaning into this muscle as I do the soft tissue work on him. So it might just look like this, but actually there's a lot more coming from behind it that makes it a little bit more efficient, a little bit more firm around the tissue. And I think that really, once you feel that, you can understand how that works a little bit better. Good, breathe in for me. Exhale. Good, kick your knee straight forward. Good. Yeah, your foot, sorry. Good. Push, push. Good. Now relax. Good. Really good. Kick forward. Good, and relax. Get a little release on that kneecap. Good. Breathe in. Exhale. Breathe out. Let it go. Let your whole knee relax. Good. Very good. Okay, nice and easy. Relax it. Let it come back. Good. So almost full flexion with minimal. I know you're protecting around it a little bit. Minimal discomfort. So good. Good response, and I can get a little bit more. I know that I'm in the right area, treating the right segment of the muscle. Good. So you feel distraction here. Good. Keep the knee loose. Good. There we go. Good. Okay. So let your knee go straight. Let it drop. Okay. So I'm going to adjust him for medial instability on the tibia and the femur. So just how the joint is moving, he's a little lax on the medial side. So I'll show you how I adjust that. This is a technique that Mark Charette taught me when I was in school. Come on your stomach for me. Mark Charette is like one of the best extremity adjusters, especially as a teacher. He's really solid. And so if you're in school or if you're learning adjustments as a PT or a chiropractor, and you want a different approach to treatment, go see him because he's amazing. He's in Texas somewhere, but he does a lot of seminars. Good. So I find the tibial plateau, I apply pressure, my down hand, and it's quick motion. Good, a little pressure here. Good. Good. So I'm applying an impulse with my opposite hand. It helps relax the popliteus muscle. It helps rotate the tibia back on the femur so we can glide into end range extension better, and it takes tension off the back of the knee. Go ahead and just flex back and forth, squat, and see how that's feeling now for me. Okay. Doing well? Yeah, doing well. Awesome. Hey, it's good seeing you as always. Enjoy the next month, and come back in for another maintenance tune-up with the tri-needling and the soft tissue work, and we'll keep working towards getting past these goals each time. Okay, I'm excited how we're doing. Awesome.
Thank you.
Well, thanks for watching.